over time. But thank you so much for joining us. My name's Olivia. I work at Wonder Foundation, and we work with locally led partners in 24 different countries to provide education and skills to give women and girls the tools to lift themselves out of poverty. And a key aspect of our project also is that we embed evidence-based mentoring. And this gives women the tools to become leaders in their own lives, to become leaders in their communities. And it's also really important, and I think this project is a great example of this, that our projects are not just providing an accreditation, a piece of training that is a piece of paper, but really are leading women into good, dignified jobs. And I'm delighted today that we are being joined by Banilad College for Professional Development. Banilad BCPD is one of our longest standing partners. They're based in Cebu in the Philippines, and they focus on delivering vocational training to women from the island of Cebu. And we started this partnership over 10 years ago, just after Super Typhoon Haiyan, which was devastating. It destroyed houses, it destroyed livelihoods, families lost everything. And we were amazed by the community spirit that BCPD showed, how they immediately reached out to their surrounding communities, but also they reached out to remote villages where they had students' families living or alumni. And this was an amazing experience for us to see how dedicated they were to building up the lives of the people that they served. And since then, also, we've worked to try to help women and girls from this community to become more resilient long term. BCPD delivers vocational training. We've helped them to provide scholarships to really make sure that as many women are able to access that training and get jobs that lead them to have long-term prospects and make them much more resilient to the ongoing challenges that face Cebu. There are many earthquakes, there are many typhoons. So I am delighted that we are talking about one of these projects today, which is Molambo. It means flourish in the local dialect. And it has trained 100 women from marginalized backgrounds across the island of Cebu. This has included many single mums. It's included women from the excluded Indigenous communities. And it has also given an opportunity to many women who have been out of work or education for a long time to have the tools to transform their lives. And I would like to take this opportunity to thank the Merck Family Foundation, without whom this project would not have been possible. So thank you very much to them. So after that introduction, I am delighted to introduce you to our speakers today. We have Beth, the director of BCPD. Beth, would you like to give us a wave? Fantastic. And with her is Cheryl, a current student. Hi, Cheryl. And then we have the programs director, who is Vanji. Hi, Vanji. And with her is Danessa, also a current student. Hi, Danessa. Hi. And then we also have the partnerships director, who makes sure that all of these students have high quality work placements that will lead into good work. Chinky. Hi, Chinky. And with her is graduate of this program, Kirill. Thank you so much, all of you, for being here and sharing your stories with us today. So Beth, I would love to start with you. Beth, can you turn on your microphone?
So good evening, everyone. After
Hi,
COVID,
Beth.
Hello.
So Beth, I would love to ask you, because BCPD has always had a commitment to ensure that the training you're offering really offers great long-term prospects to your students. So can you tell me a bit about COVID and how that led you to want to deliver this program to train healthcare workers?
Yes. After COVID, we realized that the resilient sectors were healthcare and call centers. So we expanded BCPD's programs beyond the tourism sector. We also saw how many women in our communities were struggling and wanted to expand our accredited programs to older women, including mothers and people from the indigenous communities we had already delivered short programs in.
Can you tell me a bit more about that, Beth? Because you'd spent quite a lot of time building trust with the Badjao community before you started this program.
Yeah, before this program, we already had courses with the Badjao in 2022, and we had built trust over these years. And when there was a fire last year with them, we really offered emergency support because of the partnership we had, and we were really very there are so many generous people in Cebu that were able to give donations to us. Even our hotel partners give their linens, towels, so that we can give to those in victims in the fire in their community.
Thank you, Beth. And it's another example of how you really are invested in your communities. Can you tell us a bit more about this project specifically, about Molambo?
A Molambo program, we were so grateful with Wonder Foundation for giving us this opportunity to train 100 women to be accredited health workers. We had already 4 batches of students, each enrolled for a year, starting with the training in school and being supported with the work placement as their on-the-job training at first in the hospitals and specialized clinics. They have already consolidated their skills through health outreach projects or medical missions in local communities where people struggle to access healthcare.
Thank you, Beth, for giving us this outline of the project. And I'm excited because we're going to learn a bit more about the students' experience of those things later. So, Vanji, I'd like now to move to you because you were the person who led this program, who led the development of this program. You've not only overseen the development of the curriculum, but you've also worked really hard to make sure that this was a really welcoming program for women who'd been out of school for a long time, for mums who had other responsibilities. Can you tell me why welcoming environment really mattered for the students?
Many of our students have been out of education for many years, and returning to the education can be very challenging. So from the start of the interview of our students, through the last day of their classes or their stay in the school, so we have that culture of respect and patience. That means we keep on following them up and monitoring how they are so that they'll be able to rediscover their capacity to succeed in life.
And Vanji, you've also overseen the mentoring in this project. You've been using the mentoring methodology that Wonder has been developing with the school. Can you tell me a bit about why mentoring is so important?
BCPD is using the empath model of Wonder for the mentoring of our students. So it gives these women the capacity to discover their strengths. So in so doing, we are able to, it's able to give to the students some ideas on how to persevere better and to have the determination to do their job, to do their studies well, and then, of course, to have a better outlook in their future employment.
And I think, Vanji, I mean, many of the women in the project, and I would include Cheryl, Carol, and Danessa in this because you've told me this yourselves, having that personal support to persevere through this program has been so important. And Vanji, you've worked really hard to make this project accessible, particularly to mums. Can you tell me a bit about how you've done that?
Well, we give them the flexibility of the timetable that they're able to come to school, just like coming only in the afternoon, so they'll be able to do their duties as a housewife or a mother during daytime or morning, and then even to do their jobs, their side, their maybe their what do you call this, their employment for half day, and then they'll be able to come to school in the afternoon to be able to give all the sacrifices and still attend these healthcare activities or schooling.
So this is brilliant, and I know we'll hear a bit more about why having the opportunity to balance care responsibilities and have an income during this course have been so important.
Mhm.
And Vanji, you have accompanied these women since they first interviewed at the school until you have seen them graduate in the situation of Karil, for example. Can
Mhm.
you tell me a bit about the change you have seen in your students?
Well, many of our students have been, they've been very shy, and then they have this low confidence in the first few days or weeks. And then with this constant monitoring and following up, they start to be having this self-confidence, wherein in the end of the course, they're able to be confident professionals and even emerging as, leaders in their families and in their communities. That's how they are
Fantastic.
molded. Uh-huh.
Thank you so much for that overview, Vanji. And Cheryl, I'd like now to turn to you because this has been your story. Um, Before you started this course, you had a part-time job, but you were really looking for something better for your family. You have two small children, aged 2 and 4. So you were really looking to give a better future to them. So can you tell me a bit about how this course has changed your life?
Yeah, so before starting this course, I was working part-time and looking for a better opportunity to provide more for my children. And the flexible schedule allowed me to balance being a mom and a student at the same time. So this course enlightened me and showed me that there's a hope when you dream and take persistent action. Through the medical missions, I learned the true essence of providing healthcare services to underprivileged people, which deeply touched me because I come from similar background. And this opportunity has changed my perspective and motivated me to pursue better career growth so I can support my children more and build a brighter future for them.
Fantastic. Thank you, Cheryl. Can I just ask people, are you able to hear okay? Because someone has commented that they can't. Maybe you can just mention in the chat if you can't hear. Okay, perfect. So I think most people can hear. So if you can't hear yourself, I think maybe you need to double check something at your own end. And I'm sorry if you can't hear. Sorry. Thank you, Cheryl, so much for sharing your insight with us and your reflection on what a difference this has made and is making to you and to your plans for your children to thrive. Danessa, I would like to turn to you now. So Danessa, you are a member of the Badjao community. And one of the reasons that you wanted to do this course was because you could see that people in your neighborhood have really struggled to access healthcare. Can you tell us a little bit about that, please?
I am Donisa J. Asamsa, member of the Badjao tribal community and indigenous people group from Mindanao. That are in the latest 60s. Your families migrated to Cebu. We are now living in Alaska Mambaling. From 10 small families, now we are more than 500 families.
Thank you, Danessa. So your community has, it's also known as the Sea Gypsy community, And traditionally, you've really depended upon the sea for everything. So can you tell us a bit about that?
We depend so much on the sea for living.
Mhm.
We fish, we drive, we I for birth we used to live on street houses. We need to change.
So
We need
in
to
your
change
community,
to
traditionally, you've lived in houses above the water, haven't you?
Yeah. Yes. Mhm.
But that's changed a little bit now, hasn't it? So at the moment, you're living in houses in stilts, but some people in your community have also built houses on the land with bricks. But it's important to you that you tell us a little bit about how those houses are connected.
Mm. Okay.
If it's easier for you, please do speak to Vanji in Visaya, and she can translate for you.
Sige, sa Bisaya nimo din. Okay. So the Badjaos live in with made of wood and bamboo, the stilts houses, and then until such time when they have improved a little and they made their houses out of bricks. But still, half of the community uses the stilt houses. That's what they are.
Okay, thank you so much, Danessa, and thank you, Vanji. And Danessa, can you tell us a little bit about access to basic services, to water in your community? Because this is very important for healthcare, isn't it?
the access to basic service is difficult difficult
Mhm.
difficult. We don't
Mm-mm.
we don't have running water at home, and we buy it so many skin problems.
So that's really difficult for people in your community. And but you wanted to do this course because you really wanted to change things for your community. So tell us a little bit about your dreams for when you graduate. What do you want to do?
When I graduate from this course, I want to do something that could improve the well-being of my people with teaching habits like sample hand washing, safekeeping of water, and delic- delic- the education of good health practice.
And this will make a big difference to people, won't they? Because at the moment you don't always have safe water and you don't always have rubbish collection. So it's very challenging. So I think this is an amazing goal to have. And you've already volunteered with your community during COVID, I think.
Mhm.
And this
Yeah.
is when you began to dream of doing something for your neighborhood, for your barangay.
Mhm.
Fantastic. Thank you, Danessa, very, very much for sharing that with us. Chinky, I would love now to ask you about your role in this project, because it has been your responsibility to make sure that every student has a high quality work placement, but also will get a good job after this. So can you tell us a little bit about the response that you've had from hospitals and clinics to this program?
Yeah. Okay. So in the Philippines, way back in 2019, the Universal Healthcare Act was implemented, and there are growing possibilities and opportunities for many healthcare professionals. So there has been a shortage of nurses in the healthcare industry, and that's why the healthcare services course and our graduates have big opportunities out there. And with the recent plan of the government. Healthcare has been her flagship program. So many district and municipal hospitals are in need of healthcare professionals or experienced nurse assistants and aides. So with the health outreach activities that we have had in the past 2 years, the doctors we have worked with are very impressed with our students, such that they would like to take them on. One very nice anecdote that I could share with you is that there was a patient in the hospital where our students are doing their on-the-job training, and he was really dealt with care and empathy. And that's why after his discharge from the hospital, he came to the school to thank us personally for the service that was done to him in the hospital.
So this really shows what a difference, and that the quality of the training that you're giving, that people are really noticing that these students are standing out above their peers in the care that they are providing. And one of the things, Chinky, that you have been very conscious of through this program has been its the long-term opportunities of delivering this program, but also the long-term career opportunities for students. Can you tell us a little bit about the future of this industry?
Yes,
and the future of healthcare in the Philippines?
Yeah, so we are very hopeful for many growing opportunities for these graduates. And the healthcare profession is really growing and the need is there. So there's long-term potential for our graduates in the industry. And the skills that they have acquired is a springboard for better opportunities and work work in the future. And since this is a growing industry now, they can have really better work in the future, and they can really make use of this foundation that they have had from the training.
And I think this is a moment to celebrate why this particular qualification is so special, I think, because this is a TESDA, it's a nationally accredited qualification that students who've only finished high school can do. So people who have been out of school for a long time can do this qualification, but it also opens doors to future health qualifications, which is really exciting. And I think particularly for women who've been out of work or education for a long time.
Yes.
Fantastic, thank you. And Karil, it's lovely to have you here. I know today has been a really busy day for you, and you had to run from the hospital to get here. So thank you so much for doing that. Can you tell us a little bit, please, about your work now? Because you're doing something really exciting.
Okay, so I had my on-the-job training at Cebu General Hospital, and after I finished the course, I immediately applied to that hospital and was very blessed to have been accepted. And the position that they've offered me is OR custodian. So I get to work at the operating room. I am in charge of the supplies. I get to prepare the setup for the following day. And when there are short staff, there are no nurses available. So I get to enter the operating room and assist the doctors, the scrub techs, and the circulating nurse. So it's a very nice experience. And while I'm earning, I'm also learning at the same time.
Amazing. And Karil, you were very excited to get this job, weren't you?
Yes, I was very excited.
Can you tell us a little bit about your life before you started this course? Because you grew up in the countryside.
Yeah,
Tell us a bit about that.
So I grew up in the countryside, and I've always thought that be there. But there were no job opportunities, and I really wanted to be able to provide for my family. So I went to the city, and I tried applying at call center companies, but then I realized that I'm not up for it. So thankfully, um, I got introduced to this school, and they offered me this course, and I got accepted as a scholar. So um, it was a very I'm very blessed to have been chosen and be to have been part of it.
And I think you give us such an example about why it's worth investing in people, because now you've gone from, I mean, you told me before that you were selling bags originally in your village, and now you're helping to save lives in the hospital. So it's really been an investment in so many people's lives training you. Um, and tell us a little bit, Kirill, about your dreams for the future.
My dreams for the future is to be able to still have this job, hopefully, and I want to be able to become hopefully an expert, so that I can assist the nurse more efficiently. And then while doing that, I want to have a start uh, my farm business, so I can be self-sufficient and support the community, my community in the province. So that's my plan for now.
That's really wonderful. Thank you so much, Kirill, for sharing that. And now we haven't spoken much about the medical missions, but you've touched the lives of thousands of people as part of this training by going out into the community with doctors and other health professionals. So as part of your training, you've really touched many, many lives. And Cheryl, I'd like first to ask you about this, because I know that this was a part of your training that really inspired you. Cheryl, sorry, you're muted. One sec. Yeah.
So what
Please tell us.
Yeah. So what inspired me the most was meeting a family where most of the members were malnourished. So they were hesitant to get medical checkup because they felt shy and afraid due to lack of knowledge and awareness. It touched my heart to see how fear and ignorance can prevent people from seeking the healthcare they truly need. I took the time, gently encourage and reassure them, explaining that the doctors and the medical team were there to help, not to judge. Seeing their fears slowly turn into trust was very meaningful to me. It made me realize how important compassion, patience, and proper health education are serving in communities. So this experience inspired me to become more committed to helping unprivileged families and strengthened my passion to continue learning and to be someone who not only provides medical support but also give hope, confidence, and comfort to those in need.
And this is wonderful that you're using those skills, not just in your professional goals, but also in reaching out to your community more widely. And another example of this, of course, is Donessa. Donessa, you have been so committed to your community. That's what's driven you into this. Can you tell us a little bit about what you have been doing with your neighbors to help them to be healthier? And if you need to ask help from Vanji, please ask her.
How did you help them? She's not. Okay, so Vanessa is now able to help the neighbors how to maintain cleanliness and how to, prepare them. For example, if there are some neighbors who are a little bit sick, so she's around to assist them and maybe to advise them what to do. And with her expertise in her vital signs, she's able to guide them if they need a further treatment from a hospital or a clinic.
And Vanessa, I think what is so important about this is that there is a clinic that isn't too far from your village, isn't there? But the big problem is that none of those healthcare workers speak your own language. So you're going to be the first one, hopefully, who's really going to be able to look after people in your own community and speak the language. Wonderful. Thank you so, so much. And Caril, you also learned something, I think, that was very meaningful to you on your medical mission. Can you tell us a little bit about that?
So we had our medical mission at Miller's Hospital. So the medical mission was to help children with cleft lip and palate. So I was able to interact with them and understand how important the treatment is, because I also had a grandmother in the province who had that condition, and she was bullied by children because they didn't understand, and she has not gotten the treatment. Her speech was, you cannot really understand her because she has speech problems. So that's why I realized how important it is, and I was really happy that I was able to assist in bringing the smiles of the children's faces.
Thank you so much for that. We're so lucky that in many parts of the world you can get these treatments, but when people can't, obviously, because there's a shortage of nurses, because things are out of reach for them, it's really scary how it can affect children's long-term health and well-being. So thank you all so, so much for sharing these insights from your training. I'm delighted to be able to invite questions from our audience who might want to know a bit more about this. I'd love to start, Beth, by asking you a little bit more about the fire, because I think you also took students with you, didn't you? Current students from this program, to help the Badjao community who were affected by that devastating fire. I think almost 200 families lost their homes. So can you tell us a little bit about that and how you brought everyone together to make a difference for this community?
Yes, when we heard there was a big fire in the Badjao community, we were able to gather donations from cooking utensils to rice, and most especially their linens, because they don't have anything to have on their sleeping mats, and even the industry partners, our hotel, five-star hotels, they gave their towels, linens, and even their duvet for us to be given to the Badjao community. But not only that, we have our grade 12 student cook for them, for the children, and for the families, for their snacks and for their meals. And we also were able to distribute sacks of rice and spaghetti, because there were so generous people who also believe in our advocacy in helping the Badjao community. So that makes them very trusting to us, so that when we have new programs, they really would like to also help us with the programs we have, because it's a two-way, it's win-win solution. We help them and we can help them too. They can help that also BCPD to be successful in all our programs. So the partnership with Badjao is never ending, because they always look up to us as the one that they can ask for, and we are really willing to help even with all these calamities that we are having. So they're always in the list.
And I think, thank you, Beth. It's important maybe for people who are joining us who are not familiar with Cebu, that there is regular flooding, there's regular earthquakes, there are regular typhoons. So
Yes.
it really is a challenge. There are lots of challenges on an ongoing basis.
Yes.
So yeah, thank you, Beth, for giving us that example of how you really have mobilized with these communities. Carol, I'd like to ask you because you have been a recipient of mentoring, and someone is asking a question about mentoring. So, how has it helped you to grow in confidence to have a mentor?
Um, Having a mentor really encouraged me to be better. She encouraged me to become kind, become compassionate towards um, people. And it's very important since I work in the healthcare. You have to empathize with your patients because they're sick, and sometimes they have attitudes because of of the problems that they have, and so it's very important to learn how to empathize with them. And sometimes there are times that um, it really hurts, especially when a patient um, disrespects you. But after the mentoring, then I realized that um, it's because they are in that position. That's why it's not they are not angry towards me, but they're angry about their situation.
Yeah, so it's really helped you because it's very, very difficult to manage those situations, and particularly if you yourself feel that you're struggling in your own challenges. So thank you very much, Carol, for sharing that because it's very, very beautiful and very humble. Um, Cheryl, can you tell us a bit? Because I think the mentoring's particularly helped you to balance your different responsibilities, hasn't it? And to really dream bigger for your children.
Actually, yes. So, through mentoring, I'm more confident, and also to Madam Banji, my mentor. She encouraged me to just to be confident and to be a good mom, and also um, she reminds me always that just balance being a mom and a student at the same time. So don't forget to be a mom and don't forget to be a student. That's it. Yes.
That's really lovely. Thank you so much, Cheryl. Um, I think, obviously one of the exciting things of this is that there is so much potential for this course. There's so much need for this course, both for other students who would love these opportunities, but also for there's an industry that is desperate for well-trained healthcare workers. Um, Chinky, can you tell us a bit more about the opportunities, the demand for trainees that you are seeing from industry? Because it would be great to grow this course further, wouldn't it?
Yes, so well, the exposure that the students have in the industry really catches their attention because they are they are really students who have initiative, and they have empathy. They show empathy and care for the patients that they are faced with and that they care for, and so word spreads around in the city that BCPD has this course and trains these healthcare professionals, and they would like to take on these students as their employees. Like after we have had experiences that after their on the job training, they would like to employ them immediately.
This is really wonderful. And this was one of the things that we really hoped from this project, that was that we would have a really, really high rate of employment. And it's something that we've seen, which is really, really
Yes.
wonderful. Thank you. Um, do we have any other questions? We'd love to have some more questions. I'd love to ask you, students as well more about what you have learnt on your medical missions, because I think for you, Cheryl, as particularly, there were parallels to the experience that you had had growing up in rural areas, not having great access to healthcare. So can you tell us a bit more? Because I think for many people, they don't appreciate why going into a community and offering things like support for vital signs is such an important thing and life-changing for some of the people that you meet.
So actually, they're always asking about vital signs, if it's necessary, and they always thinking that they're fine. But we always encourage them that vital signs can help them, especially in rural areas that they don't usually manage about their health. They don't um like they don't talk about it and take care about it. So I really encourage them to take especially vital signs, which it can help them to yes um to because vital signs can be can help if there's something or there's something bad about your health.
Thank you, Cheryl. And this means that people go to hospital in good time, long before something becomes more dangerous, which is really, really important. Beth, tell us a little bit more about your dreams for the future of this course as the school's director. I think obviously in COVID, you saw how many nurses were already outside of the country and how when there was a great need for healthcare, suddenly it became very clear that there simply weren't enough people working in the hospitals. So can you tell us a bit more about your dreams for this course and for the school's impact in society?
Yes. Hopefully, the course will continue because even up to now, we have already our fourth batch. There are so many still applying, and then we just accept them so that if ever there will be more grants, we already have applicants. And if ever, because really what Chinky said, that the governor flagship is on healthcare. So we need this course, and we may also be in partnered. We will also do partnership with the provincial government. For now, we are having on-the-job training with the LGUs, and hopefully with us district hospitals. And with that, the government will be able to learn that we have this quality training and they need more people. And that would be a very good gauge that they will give us a grant also from the government side. So that's what we dream of, because we wanted to
Yes.
continue even with our own Cebu people to be in the provinces, because the hospitals really are in need of workers. Just like an example, Carol was able to come very late because she was not allowed to do her day off. Supposed to be it's her day off today, but she was asked to report because there's no one to. So that's really, there's a need, a very big need, and that's the dream that we would like to continue the healthcare and even expand our not only to 100, but perhaps more, so that we can help more.
That's amazing. And we have to cross our fingers that there'll be many more opportunities to build this project further. And Beth, we have a lovely question here about, what has this project taught you as a leader? Because you had a big dream. Can you tell us a bit about how it has taught, what it has taught you as a leader?
It has taught me so many things, that being a leader is not just giving demands, but you really have to lead the people that you are leading. It's not just giving demands that you do this, you do this. You do it with them. And they're happy to do it with you too. So it's really teamwork. And when we said that we are having healthcare course, everyone was really excited. And that was a learning lesson because, oh, what will we do? We don't know anything about it. But when we started to get instructors, because it's a new one, it's a new program for us, but everybody helps out. So we were able to have a structure of the healthcare services, and it grew. And because of you helping us also, and that's what we are dreaming of, to have a consistent and permanent program of healthcare, not only just for this project, but beyond these years. Yes.
And I think one of your amazing qualities as a leader, Beth, which you haven't mentioned, is how deeply you listen to all of the students and the people around you, and you really know your community and its needs so well.
Yeah.
Um,
Thank you.
Fantastic. So for you, Vanji, you know, obviously you've been deeply involved in the design and delivery of this course. What have you learned from delivering this course that maybe you would change in the future to ensure that even more women and girls facing challenges, women facing challenges would be able to really participate in this course? Sorry, Vanji, you're on mute.
Mm. Mm.
Okay, so I always encourage our students, to be very confident in their capacities, because as women, especially now with the women empowerment, I always tell them to keep working, or maybe keep pushing for a higher, what do you call this, higher decisions in life, so that they'll be able to help more in their families. And then maybe even the husband, they can also help him be able to cope with the family life and support them with their education and their future and their way of life. And also to be able to, participate in the civic society, wherein they will help their neighborhood and the people around them.
So you see that these women are being heard more in their family, and that their decisions are carrying more weight.
Yes, you're right.
Yeah,
Yes, that's how they are. Mm-hmm.
this is amazing. And for example, Kirill, if you think of your classmates, because now all of you have graduated, do you see that they are more confident and that they are doing things in their families and communities around them?
Yes, I do. I still have I still communicate with my classmates, and um most of them have jobs already. Like for example, Ate Marife, she's been hired multiple times as a private caregiver at Perpetual Succor Hospital here in Cebu, and also she also takes care of children as her part-time job at J Park, which is very amazing.
Yeah, so people are really maximizing their income generation opportunities. And I think that's one of the things that you've all told me, is how important it is from this program that women are able to save and really have that opportunity to have a nest egg for the future and have that financial freedom to do whatever it is that people dream of doing in the future. Thank you, Kirill, for sharing that. Um, does anyone else have any questions? I think they're coming through to me a little bit haphazardly, unfortunately. Um, yes, this is a lovely question. So, Beth and Vanji, you were really involved in the process of reaching out initially to the Badjao community and building trust with that community, recognizing the fact that often women in that community didn't always have, they needed to ask permission within their families to do different things. So initially building trust was quite hard. Can you tell us a little bit about how you went about that process? And Danessa, if you want to add anything, please do.
Okay, so what I did with them, especially when Madam Beth informed me about uh, welcoming Badjao community with us in the school. So every time that they come to school, I would first greet them, say, hi, how do you do? So make them comfortable because they're quite shy. So I always ask them, how are they? And then how they're facing their subjects, and if they have any difficulties, and I try to encourage them and just to listen, and then just be attentive to the teacher, and then you take a look at your classmates, you ask them if there are things that you don't understand. And every time that they come, whenever I see them from a window, I always go and meet them. How are you? How was your day? And I hope that that's what Danessa also likes to come to school early, because she knows that I always greet her whenever she comes to school early. Is it true, Miss Vanessa? That's how it is.
So Danessa, you felt very welcome in the school.
Yeah.
Good. And Beth, you made a big effort to go out to the community and build bridges with people initially. Can you tell us a little bit about that? Because I think you had conversations with some of the community leaders that really made a big difference.
Yes, in the beginning we were so like a little bit of being not so free to go because of what we had heard, but we need to help them because we already have contacted some of them, and we wanted to see for ourselves their condition. But you have to be ready when you get there because it's not really that sorry to say, hygienic, but we have to be there for them to see how we really are honest to help them. That's how they build trust on us, because not many are going to their place because, as Dunesa said, there's no running water, there's no hygiene in their place. So that's the first thing that we have to teach them, educate them in that aspect. So being them in the healthcare, encourage them to help the community for their health and hygiene. And then we were able to meet the mothers and the husbands. Their culture is that wives should stay in the home while the husbands are doing their businesses or selling something, or of course earning for the family. But we have to talk to the husbands that women also have their life to share, and it was a very challenging one until they were able to understand and allow them to go to school. So the first thing, we had the orientation in their community, and then we wanted them to learn, so we let them come to BCPD. So the first orientation was really a very challenging one. That's their first time to wear socks and shoes, so they don't really are used to it. So, but we have them say that that's the policy of the school, so they have to follow. And little by little, they were able to do it. Now we have on the third batch, and these are in the healthcare. So
Yeah.
there is already an engaging. So we call them, they call us, we go to their place, they come to our place. So
So it's really great that you have that trust. And I think it just goes to show what a difference it makes. And for you, Donessa, the big differences and small differences that you have to, and things that you have to learn, because obviously also in the hospital, it's the policy that you have to wear things or do things that you may not be familiar with. So it's these small things as well that can take a lot of time to get used to. So thank you very, very much, Beth, for sharing that. And it really goes to show, Danessa, why you are such a pioneer in being so ambitious about creating change in your community as a woman and as a healthcare worker. So we really are championing you for your future goals. So I think, unless there's a last question, and I don't think there are any more, I would just like to leave with a question for each of Cheryl, Carol, and Donessa, which is, where do you dream to be in 5 years' time because of this program? Carol, if you think of yourself, where do you dream of being in 5 years' time that you wouldn't be if it wasn't for this program?
So I imagine myself 5 years from now, I'd still be here in Cebu. Hopefully, I would still have the same job. If not, I'll be applying to a higher position at the healthcare industry. And then while also earning, starting my farm business, hopefully.
So we wish you luck with this, because I know that your parents would be really delighted for you to achieve both of these things and to really invest in your village as well as your career. So thank you, Carol, and we really hope that you will achieve that. For you, Cheryl, what is your dream
My
in 5
dream.
years' time?
So 5 years, I think I can see myself in a hospital taking care of patients, not just taking care, but providing hope. Because I really love taking care, especially kids, because I have 2 kids. So it's really in my heart. So I can see myself 5 years from now taking care of many kids in a hospital, providing light and hope so that they can be so it's um for them to heal faster.
Fantastic. And I'm sure they will, because you do bring so much light everywhere you go. And to you, Donessa, we know your dream. I think it is to have a clinic in your community in 5 years' time. What would you like to say to everybody about your dream?
Okay, what Donessa wants to achieve in 5 years' time is she hopes to be the first healthcare Badjao who will be taking care of a health clinic and then serving his constituents, or the Badjaos, to be able to have their upliftments in their lives and to improve their livelihood around their community in Alaska Mambaling.
So, Donessa, I hope you're going to give us updates on this, because we'd love to see how this develops and to really champion this goal, because it's such a beautiful goal. So good luck with it. So thank you so much to all of our speakers, to Donessa, to Vanji, to Beth, to Cheryl, to Carol, and to Chinky for joining us. And thank you to all of you who have joined us, who've asked questions, who have shown an interest in this project. I really hope that you feel as inspired as I do about what these amazing women are achieving, and also interested in supporting us to continue this project going forward. So thank you all very, very much for joining us, and we will keep in touch. Thank you so much.
Thank you. Thank you.
Thank you.